Love it. And so while we're on that topic, what are some other myths that people have about, red light therapy? Some people say, it's not good to have it on your face. It's not good to have it X, Y, and Z. What are some of the myths that you are commonly coming up against with red light therapy?
The first thing that comes to my mind when you say that, it might not be a myth. I think it's just more of a mentality, and that's more is better when it comes to red light therapy. And I think that's where a lot of companies have it wrong. And I don't know if that's just because it's a lack of education or it's just that mentality of more is better. But I think most people that do red light therapy and they don't see results is because they're over treating. And I guess that's, the caveat to that is the beautiful thing of red light therapy is if you overtreat, there's no negative side effects. You're just not going to get the results you're looking for. But what I like to harp on whenever I do like Instagram lives or podcasts and I'm trying to educate people is that there really is this concept called the biphasic dose response, which is essentially a bell curve. And on the left side of that bell curve, you have where the dose is too low. And the dose means your body's not absorbing enough joules, enough light energy. And so the dose is basically three variables: the light irradiance, which is how much power is your device putting off, what's the distance you are away from the panel, because the further you are away, it's kind of exponential. You're going to lose more and more light power and light irradiance. And then, of course, the duration of the treatment. So the dose, if it's too low, which I would argue very few people do, it would be any combination of your device isn't powerful enough, you're too far away, and or you're treating for too little of time. But I think by far most people are on the other side of the spectrum where they're probably just over-treating duration, but maybe they're too close and, relative to the power of their device. So that's really why I developed the Red Light Therapy Treatment Protocols ebook, is to really take the best of the current research, see what those different, pieces of research are doing, how many joules are they treating with what population for, what's your ultimate goal with red light therapy? Is it sleep quality? Is it skin health? Is it athletic performance? Because all of those are going to take slightly or, quite different protocols. For example, if you're doing anti-aging skin health, you want to be about 18 inches away, and 60 to 120 seconds is more than enough. If all you're going for is like getting rid of the wrinkles, keeping your skin nice and plump, that's all you need. Whereas if you're treating, let's say, anxiety, depression, you want to be using near infrared light, because near infrared light penetrates deeper, which we can get into more specifically if you want. But then you want that facing your frontal lobe. Some research shows that the right lobe is actually more efficacious than the left. And you'd want that on for, 8 to 10 to 12 minutes, because you need that light to penetrate your skull and get deep enough. And you need enough energy to get to the brain and to the nerves to stimulate that effect. So even those two treatments alone take profoundly different protocols. So the blanket statement that a lot of companies or a lot of people are touting that 30 minutes a day is going to treat, X, Y, and Z, I can't buy that. 30 minutes is a lot to me, unless you're standing a decent distance away. Will you ultimately accrue benefits? Probably, because again, you're stimulating the mitochondria, but chances are you might be overstimulating it, especially if you're doing it every single day, which I would argue you don't necessarily need to do. So that's maybe another myth, is that people think they have to do it every single day. And more or less, it's like exercise, where you're stimulating your body, you're causing a stress response to a small degree.
Right.
If you exercise every darn day, you're not giving your body time to recover, adapt, and come back, with more resilience. And that's really what you're doing to your mitochondria, is you're causing this hormetic response where you're stressing it. It's producing more reactive oxygen species, which in small amounts is a positive thing. Your body reacts, comes back, builds a stronger and more resilient. So the next time you do it, it's more able to withstand those stresses. So, those are a couple of the myths, I guess. And that just ultimately comes down to the mentality of more is better.